Okay,
Perfectly fine.
good. Thank you very much. So we've started recording this DARWIN DCoP webinar, managing available resources effectively to handle changing demands. And I will hand the word over to you, Matthew. You can take it from here. Thank you very much.
Yep. So, Frederick, thanks for being here. As you can see, you're the only one from the DCoP, so I think we'll keep it quite informal. And then I hope it's going to be as much of a discussion as possible. Jonas and Odeya, it's actually Frederick. You might not know, but Jonas is from FOI. Odeya is from BGU, Ben Gurion University. So Jonas from the Swedish Defense Agency in Linköping. And so both of them have been involved also with the development of the guidelines and have also conducted these sort of rapid prototyping sessions, but not on this topic. Which means that for all of us, it's going to be an opportunity just within the project to share what is the status of this guideline in development and get some feedback from you all as well. So my aim was to sort of come back on this objective of this rapid prototyping. I'm not going to spend a lot of time on it. I think we're going to dive into the details of what we have currently very quickly. And what I had in mind for presenting the details was to sort of look at an overview of this topic and then quickly go into some of the interventions that might be proposed, and especially related to the various phases of a crisis. So how we build the capacity to manage those available resources, how we support that capacity during events, and potentially how we learn from events. So after the fact. And then discuss some existing practices, methods, and tools. Frederick, you were mentioning your discussion with St. Olaf. For you all, St. Olaf is the university hospital in Trondheim. So they work a lot with our local university, NTNU, and so they are both a very important regional center, including regional center for all kinds of emergencies, for example, burnt victims. But they're also a research center, so they are doing all kinds of interesting research, whether it's on IT for healthcare or whether it's on special treatment or etc. etc. So yes, and I was mentioning that because in terms of practices and methods and things like that, when I looked at the literature around this topic, a lot of it actually was described in the context of healthcare. This idea of being able to handle sort of surges in demand and having that kind of surge capacity, and the idea of having some kind of flexibility of resources and things like that is something that the managers of hospitals, for example, are confronted with and have been thinking about for a long time, I think. So Frederick, just as a quick reminder, this picture that you see here, that's the overview of the development process that we have been using for the guidelines. So we start with this initial, which is an initial list of requirements. Those requirements came from a large survey of the literature, as you've heard before, and so they are basically, the requirements are statements that correspond to particular capabilities that we think are important to enhance and to build in order to properly manage resilience. And so in the context of the topic we're discussing today, I'm trying to remember the statement was basically organizations need to address the best use of available personnel. So that was the statement that we started from. So from those requirements, basically what happens typically, and what has happened throughout the life of the project, is that there has been, cycles of drafting, essentially based essentially on the literature and on the the people's knowledge within the consortium, so the various people that were involved in developing the guidelines. And so that has led to basically to the creation of a draft to the best of our knowledge. There has been a phase that we have called adaptation to sort of present these drafts to members of the air traffic management community and members of the healthcare community, based, using our partners that are part of those communities, so people in Sweden and people in Italy. And that adaptation process has basically led to various improvements, and all of that is, very iterative process. But in any case, it's a general process of, sort of going from the literature, going from the concepts, going from what is documented in operational or scientific literature, to basically having somebody with an operational perspective look at the content and help basically revise it, provide feedback, provide input in order to improve and progressively basically build those resilience so that they are they are operational, and so that they are usable by potential end users. So the rapid prototyping, the idea was to try to basically from the beginning, have that in a very sort of participatory design way, by including from the beginning the people from the operational world, and especially using the DCoP for that purpose. And so we had that event in the workshop for that. And so once again, the goal is to generate this content that is motivated by operational considerations from the beginning, and basically use essentially the same sort of iterative process, but in a sort of fast forward way, and with the hope that basically we can reach a higher maturity and a higher applicability, and I mean, especially faster, to do it faster. It's we have. So this is what happened at the workshop. So we had 3 different topics considered, and so those 3 topics basically will be new. I mean, you remember we talked about those cards, that we call them capability cards now, not concept cards anymore. But we have all those all those cards, and those 3 topics will be at the end of the project will be new ones compared to the ones that you saw in Linköping in March. And so what we are hoping is that basically, even if we only develop them over the course of a few months compared to the long time we spent on the others, and even if we have fewer opportunities to evaluate them and to show them to operational people and things like that, we will still be able to reach a sufficient level of maturity operationalization, basically. So yeah, I don't remember which topic. I don't know which topic you were part of, but basically the one we're addressing today is this one. Which is was stated as addressing the best use of available personnel. And that was my question. So once again, do you remember, Frederick, what you were part of at the DCoP workshop?
I was part of the involved in the public, naturally, because that's what I'm basically doing. Because the observation is that available personnel within an organization is what they already have quite a good access to. All everything is, all the systems are very much focused on that. What needs to improve is to coordinate and get access to resources that are outside the normal situation. And at the moment, that's basically done by voice coordination through phone calls over the secure network or with just a normal phone line. And there's a lot of information. So, and training.
Yeah, absolutely. Yeah, and so I mean, we'll discuss today. We'll focus on this one. So, just as a reminder, you might have seen the invites, but this involving the public will be discussed towards the end of the month. So in 2 weeks, I think, from today. And this one, the support development of alternative methods, will be discussed as a webinar also at the end of July. So we are having basically separate webinars for these 3 separate topics. And so what you were discussing was also this sort of I mean, in the discussion we had in Linköping with the people that participate in this session, this I mean, we saw that there were potentially lots of overlaps with this public involvement. So yes, the idea of how you bring in people from outside the organizations, potentially people from the civilian either organizations or civilians period, is an important one, and how to do that. So we're still a bit unsure about whether this is part of the scope of this particular capability card also, or if it should only be covered by the involving the public one. So that's still to be done. Yep.
Just a comment there on both of the DCoPs I was part of. I remember distinctly that the gentleman from Israel thought that the societally preparedness was the key to resilience. If you didn't do that, you didn't get any resilience, basically. So.
Yep. Yeah, and for an ODI, that's the kind of discussion in which you can jump in, because my understanding of conversations we've had with our partners and colleagues from Israel is that this is something that of course they have put a lot of emphasis on and have been very good at doing, much more than in our other European countries.
Yes. They will be happy to.
Yeah, so that's definitely something to be discussed in 2 weeks in detail, because I think lots of people will be interested in that over there.
Okay.
So based on the sessions that happened there, basically we used and the other people also, these other topics did the same thing. I mean, we used the wiki to start creating the guidelines, and so this is currently what I hope it's my screen is visible correctly.
It's good, Matthew.
Okay, but basically we have created sort of a draft version of that particular guideline or capability card, and so I'll come back to that. And so what I was hoping to discuss today is basically to show what we have so far, and to have mostly discussions and not just presentation from my side. So hopefully I will be a bit less taking the microphone, and basically get feedback and input and suggestions. So quickly, an overview of this particular topic. So once again, it was phrased as address the best use of available personnel. That sentence, the first thing we did in the session was to try to sort of look at this sentence and clarify what is meant. Basically, we all agreed that the term best was probably not the best, because we didn't want to go into sort of efficiency type discussions and sort of optimization type discussion, but rather really the issue at hand is that there are the crisis situations create changing demands, create surges in demand, or create demands that are of a different kind than the usual situations. And so you need to basically, not necessarily efficiently, of course efficiently is a nice feature, but mostly effectively handle those demands. And in order to do that, you might need to manage in some way the resources that you have, and so manage in a flexible way, especially. The focus for this particular topic is on human resources. It's really on the personnel. But through discussions and through the literature, and when you look at it, the general issue of sort of managing resources in a flexible way is potentially spread to aspects of the technological equipment or aspects of supplies, especially. There are classic examples of, for example, the use of fuel supplies in Katrina. It's a well-documented one. So one of the things that we are still considering is whether we should also sort of, how to manage this kind of tension between the need to be relatively focused and the need to potentially cover these other areas.
If I stop you there for a second, Matthew, Fredrik,
Yeah.
I'm quite sure you would have your point of view on that statement. Should we include other resources like technological equipment? What would you say from your point of view? What could you bring to the management and the effective way of possibly contacting available resources in your case?
Well, the current way is to compile a list of volunteers or resources, and if they needed, they call them. And then they have set, I know that the fire departments have set up agreements that if they call and ask for a digger from a farmer or from an entrepreneur, there's a price tag attached to that call, and what they're worried about is that who is the organization who actually orders the equipment, because the invoice for ordering the equipment go to the organization that orders it. So the fire department is organized under the municipalities, but the police is organized within the Department of Justice, who has no limit to their budgets. So everyone wants the police to be the one who orders the resources, but they are not the ones who actually have the overview of what resources are available, in my understanding. The other way should include civilians is that what they say is yes, we should, in regard to get help from civilians, because they are the ones who are first on the scene, but also no, because if you involve the volunteer organizations, they are trained to work together, and getting a new member, ad hoc member to their unit, so to speak, who's responding to that, actually decreases their effectiveness and forces them to divert resources to keep people away. So it's a double-edged sword. In my response to that is it's about communication and using available communication tools in a more efficient manner than is done today, to both be able to other available resources in the area of where the situation is happening more efficiently, but also notifying the public about what to exactly do. Because what I again heard from the colleagues from Israel is that when people actually feel that they do something useful, they actually manage to continue to do something useful instead of just standing paralyzed and getting in the way.
Odeya, thank you, Fredrik. Odeya, would you like to comment that? Do you feel that ad hoc members could contribute during an event, or should the focus be on established organizations and their response?
I think that both of them can contribute, but ad hoc people can also. No, I don't have something special about this issue.
How is it organized in general terms in Israel then? Do you have ad hoc civilians responding, but with a general training just in the way your society works, that even though if you're ad hoc, there's a general consensus of the training you have when you respond?
Do you mean that some people from the public or simple people, or from responders from organizations?
Well, if you take the general public to begin with.
In most of the times, they're not involved in training. I think that it is important, but actually now maybe we have to increase it. But in most of the time, there are some times that we have searched what we wrote about it, that we have searched that these people is aimed to be involved. It's not the training all the time for this situation, but they're not. They have to be part from that organization or something like that.
Yeah. Okay. And Fredrik, bring it back to technological equipment. I know your product could aid in that, but in what way do you see would be the general benefit from the product that you're working with?
Well, I doubt many societies has the ability to purchase an approved phone or a walkie-talkie that for everyone, so that they can be part of a secure communication network to be able to respond. Maybe that worked in communist societies, but it doesn't work in Norway, at least. So if you think about one of the things that are very frustrating, and some of the people who work with me also things are very frustrating in Norway, is that whenever you talk about expanding the capabilities of the official or organizations with the in emergency, it is by training volunteer organizations and give them that the emergency walkie-talkie that's part of the Tetra network. The problem is that you can't give that out to everyone, and then you will only have those who are not on vacation, who are and also for some reason have their radio with them. You can only access those resources to sort of be a quick response. So if you really want to expand the possibility of using all the resources, you need to have a system that can be run on the phones that people are actually having in their pockets, which is an iPhone or an Android phone. And but in order to do that, you also need to have a secure channel of communication. You actually need to use sophisticated encryption and being able to set up communication groups on the fly with the people that are on the site. And that's what my product has developed and are continuing to develop. But you need a cultural shift to really sort of take that into account into their planning, because it's a little bit old-fashioned at the moment, and that's kind of frustrating.
In Israel, the most popular means it's with the WhatsApp or social media or something like that, but not secured talkie-talkie or something like that.
So you're saying in Israel there are, I mean, the idea that the exchanges with the population would occur around non-secure lines is fine. Basically, it's accepted in the context of those events.
Yes, I don't say that. Of course, that the emergency organizations they have networks that they work, especially in they have special channels, but with the people and a lot of time, even with the experts or the first responders, the officious first responders, it's with WhatsApp.
Yeah.
It's very popular in Israel, very popular.
That means you don't have the ability to increase the capability of your platform, and that also means that it's on unsecured networks, which is what is frustrating is that is fine in the context of the emergency, but an emergency is not a normal situation. So if you want to increase the capability of and automate, for example, a transfer of time-critical medical information, you can't use WhatsApp or Facebook platform for that, because you will have a breach of privacy. But if you have a system that is like a social media in functionality, but is built on a secure platform that is suitable, and that have many functions also in daily life, then you get the training with people interacting with it in daily life, and you also get the capability on ad hoc management of both professional and layman resources to handle the situation. You can, of course, rely on totally unsecure systems, but then you are severely limited in what you are actually able to do, except to give them a message about do this and do that.
Yeah.
Fredrik, in your plans, who's responsible for sending this information out to the public?
The official emergency services, or municipalities or official responders. That's part of those who don't know this model system. They can just in 2 seconds define an area of whatever size and send a message, and everyone who has the smarter application on it can get it as a push notification and straight into the application. But also you can send it out to social media and all the other platforms, but with link to a secure way of showing the information and the way for them to take it to the smarter platform if we want to contribute. But in order to increase the scope and the increase usage of this, it will also allow private organizations to have the same capability on the same platform, and not only in our application, but also as a software development kit for their own applications, to create this same network of communication that is they can use in their daily life privately, but in the event of a greater event, you can actually just link those networks together and have a secure platform to exchange messages and share information without being overwhelmed. Because that's the other problem with, for example, allowing the public to share information to the emergency services directly, is that you will get totally overwhelmed if you don't have a good user experience design and good filters. Because normally today you have call takers that can handle one call at a time, and there are 4 call takers or 16 call takers or wherever you are in Norway. If there are more than 16 calls that comes in at the same time, then it's not visible anymore. And if you have bigger situation like the 22nd of July, or in Israel, I don't know, that you have probably very big incidents there. You may have thousands of people trying to reach the emergency service, and things just break down immediately. But with our system, you'll be able to see everyone that actually calls in. You can able to handle them. You can give messages out to them before they call in. But if they have called in, you can send special messages to those who actually show that we are on the case and know about this. That makes people calm down and be able to handle more appropriately and more effectively.
So I think those are. I hope you're planning on being part of the webinar in 2 weeks as well, on the involving the public, because I think this is these are important aspects.
Okay.
Of course, I would love to.
Thank you. Thank you.
Okay, so you know, we've talked about lots of things already, but I wanted to give you a sense of some of the things that have been considered. So I'll skip the illustrations and examples. I mean, you gave some interesting example. The you know, the sort of the use of farming equipment, for example, would be an example that we can build from if we were to consider also non-human resources. But basically, in the implementation of what we have in mind, so the basic idea is that the crisis situations, they require sort of additional resources than usual, right? And by additional, it's not just more of the same. It can be also of a different kind, because, for example, the nature of a crisis at hand is of a different kind. So that's the basic idea. And the sort of other underlying belief is that in an emergency situation, in a crisis situation, if you are basically, if you request those kinds of additional resources at the moment where you need them, it might already be too late. So the argument is that basically it is particularly important to create the conditions for those resources to be basically to be provided as when they are needed, at the moment they are needed. So we've decided, as a result, we've divided the you know, sort of activities, especially put some ideas of activities for the before and during phases that are here on your screen. Part of it is relates to what you were saying, Frederick. That's the idea of having a potential roster about the available resources. This is something that is described in different papers. For example, this is something that we discussed also in the Linköping session, where, you know, there are lots of people that have basically described that it's important to have, you know, sort of a list that's available, where you can see, you know, who could be available, who is able to do what. So include also the skills that people might have. In the healthcare domain, this could mean also including the credentials that people might have, the kinds of I don't know, medicine they can push, you know, those kinds of things. And basically the idea is to be able to use that to sort of match you know, potential resources that are outside of the normal resources with the operational needs of the moment. One idea that also is well described is the idea that, you know, you in those circumstances, when we think about using the personnel, I mean, you might need to sort of increase the radius of the system you're considering, and looking at, for example, sharing personnel across departments of the same organization or across organizations themselves. But that means creating the conditions for that. That means, for example, training together. That means creating agreements between those organizations or between those departments so that resources are used. An example of that is I worked some years ago in the context of industrial maintenance, and there was a particular tool that was that had been developed by Beth Lay, with whom I was working, and this tool allowed basically allowed her and her team to pull in experts from her organizations, from different departments, for quick, like rapid emergency phone calls, so sort of phone conferences. So a team of experts will be pulled from different departments, so that basically they have sort of a call in which they discuss a particular situation at hand and help making a decision relative to a problem that that is being faced by some team in the field. So for those experts to be pulled in, that means that those departments have, there's an agreement that this mechanism means that the department will temporarily release their resources so that they are used elsewhere. And since they are expert people, of course, they are always busy and always accomplishing tasks in their own department. So the department has to agree that temporarily they won't be available. It's a valuable resource in a sense, and so of course, as a valuable resource, it's everybody wants to use them, right? So that kind of agreement is something that needs to be in place. It needs to be in place before. I mean, it's not in the middle of an emergency that you have to start discussing whether it's possible to use somebody else's resource. One other important topic around that is the prioritization of activities. That can be also anticipated to some degree. An example of that is there's a paper that describes the response to a bus bombing in Israel, which is a very interesting paper. It describes the response from a hospital, and one of the things that they describe very well is how the hospital is able for the managing the response, is able to basically drop some of the regular tasks, for example, some of the administrative tasks, in order to fulfill new tasks that will arise during the arrival of patients. So, for example, tasks such as welcoming the families and providing information to them, right? So those types of switches between activities is something that is planned in advance, and not something that is discovered at the moment of the event. Odea, did you want to add something?
No, I think that it is important. Yeah, I agree with you. But I wonder if we have to, if we have in writing these guidelines, we have to think about some activities that we have to change or to leave it now. I don't know which level we. If you say about actions that during emergency the organization wants to do it, and another activity that we want the organization to do it. So do you think that we have to write it right now? What do you think about these activities, or just to write it general?
For the purpose of the guideline, I think we should probably stay relatively general and maybe illustrate with examples to give people a sense of what is meant.
Yeah, all right.
But I think for example, in this context of a hospital, it's the example I gave is sort of the administrative tasks versus communication to the family task, and that is something that is related to that particular context. But in a different domain, in a different kind of event, it might be, something else. But overall, that general problem will exist. That is, there are tasks that are covered on a routine basis by people, and those tasks, take a lower priority at the moment of crisis or a particular event.
Yes.
And once again, this in this example, this very interesting paper, it works well because people don't discover that problem at the moment of the event. I mean, this is something that they have done before, that is planned, and so it could be expressed in the context of, for example, this hospital. It could be expressed in the form of guideline, could be trained on, etc., etc.
So maybe it's important to identify before the crisis, to identify what will be the important activities.
Yeah, exactly.
An additional example, Mathieu?
Yeah.
I think in the ranking, wrote an article a couple of years ago that's called "Resilience in Everyday Operations," where she and some other, Rocher is also a co-author there. He writes about the method of the variety space. Variety space, and they have some examples there that I think could be interesting for this card to use. For examples of practices. For example, there's one case where there was an increased number of births in a maternity department, ward. So I think there was a doctor there who sent home all the fathers to release available beds for patients instead. So that's an example we have in that article. So a way to increase resources in a novel way, because that was a new decision that hadn't been done before. So just a tip.
Yep,
I think that would be a good references for this card.
Yep. The other topic that is also this we didn't discuss too much in Linköping during the interactive session, but is discussed in literature is this sort of also the need to anticipate the sort of issues of authority about who controls the resources. And the classic example of that, and that has been described as not always very well managed, is Katrina, the response to Katrina, with a command that was generally very centralized from some national organizations, but a discrepancy basically between what the national organizations, the actions they were taking, and the reality of the situation. So there's a need to sort of anticipate those issues of authority, and for example, consider the needs for some level of flexibility at the local level to control resources in a fast way, and in a way that also is tailored to the local conditions that they are experiencing, and then the local knowledge, the context of the crisis. And so last is this idea that specific mechanism. So the example I gave in the industrial maintenance is actually a specific method or a specific tool that was called rapid risk assessment. So this is an example of a very specific mechanism that is built in the organization to bring in a particular situation additional resources, in this case experts that are not dealing with the situation normally, and bring them in so that they can help with problem solving basically. And so that's the kind of reflection also that the organization should go through. Any comment on that, any of you? And Frederick?
When you were talking, it reminded me of a document I got from the county municipality of Trøndelag for a school shooting situation. And they sent me a PDF where that showed the complexity of what a principal at a normal school had to, what they were facing in order to handle the communication issues of a school shooting, and which lasts for 10 minutes, and then a lot of people are dead. I sent it as an email to you, so if you can open and show it, you can see the mind-blowing complexities of what they are facing. It's in the PDF there, yes. Yeah, blow it up.
Yeah.
And this is V1 is what happens. There's a shooting going on. What happens then? You need to contact the emergency services. You need to contact your students. You need to contact all your employees to get people out. You have to contact those who are who should start to involve themselves in handling the case together with you. But you, as the principal at the school, is the one who is in the center there and are by regulation the one who has to handle this. So this is what I mean about in order to handle this efficiently and communicate efficiently and share information efficiently, so that it may have a meaningful effect during an event, you need technical support. And if you try to do this by voice only, through different means, you basically can't do anything. Not really, not during the situation. So when we talk about preparing ahead of a crisis situation, this is a very excellent picture of what you need to prepare ahead in order to communicate effectively, and then you have to execute it during a crisis where people are dying. It's not an easy task unless you actually think about better technical systems to support you. That can scale outside your normal organization, because all those bubbles there are different, either organization or stakeholders that have an interest in what is happening. Core principle.
So if I understand correctly, so the rector is he's communicating with ANSAT employees.
Yes.
And
something happens. There's a shooter. We don't know who it is. Probably a student. Most school shooters are students or former students of the school, apparently. And then you need to someone needs to call the emergency services, and ideally you should at the same time get a notice that the emergencies have been contacted, so that so that they don't get overwhelmed in handling multiple calls from the same situation. And then you also need to meaningfully give, probably in exercises ahead of the crisis, have a way to respond that is fairly effective, so that you get people out or at least safe. But the problem is that in the school shooting situation, it's a student or a former student, so that they are on the inside of any plan for how to respond, or if you have a communication system they know they are sort of trained in what is happening, so that they can anticipate. And then people, there is a lot of people who will try to call the principal or their employees to try to coordinate this. There will be information that is sent out to the media, there is information that is sent out to the parents, and so on and so forth. And sort of all those steps in this is what the principal need to manage from the beginning to after the crisis has sort of happened. So it's if you do this by voice, it's basically a breakdown.
Mm. Okay, thanks. So in the meantime, I see that we have a couple of people that have joined us. Hello. Hi, so my name is Mathieu, and I'm leading this discussion for the moment.
Yes, hi, I'm Zhao from Stanford University. I've worked with Carl Oscar Johnson at Linköping.
I
recommended I get in touch with the DARWIN network. So.
Okay, great. Thanks for joining. I'm afraid we have started a little while ago, so hopefully you will enjoy the rest of the conversation.
No problem. It's quite early here, so I'll catch the tail end.
Yeah, I can imagine.
Right.
Yeah, well, welcome.
Can I just, my name's Ewan, I'm sent the invite to you all. This session is being recorded, is that okay with you as well?
Yes, that's fine.
That's good, thank you. And then you'll be able to catch up on what's been said at a later date as well. Thank you. Sorry, Matthew.
No problem. Okay, so we talked about sort of the various things that could be done before a crisis. During a crisis, these are a couple, rough ideas about activities. One of them is this sort of this actually managing the reallocation of personnel, and a couple examples. So in terms of tasks, I gave the example of the hospital management of tasks, for example, for people dropping administrative tasks and picking up communication-oriented tasks, and that would be an example of reallocation. In terms of location, one interesting example is what they do in urban firefighting. So urban firefighting is a domain in which one of their problems is to basically ensure that an area has sufficient coverage. So as a result, when there's a fire somewhere, what the issue is that you will have a couple of firehouses that will send their companies. They're typically the ones that are closest, and so those firehouses will then be empty, which means that the area that those firehouses are normally covering will be depleted. And so there is I don't know if it's done everywhere, but at least in some cities, there is a sort of a dynamic relocation of fire companies to sort of spread out over areas when you have some that are already deployed, so that you maintain some kind of coverage. So that's to me that's an interesting example, interesting practice. In terms of using the resources that you have, which are limited by definition, and which basically you're trying to literally spread so that you maintain coverage of the capabilities that they represent. But once again, having that kind of dynamic relocation is something that should be part also of the various guidelines that are built in advance. It's not something that is easy to coordinate and do correctly if you're discovering the problem during the crisis. Another sort of type of activities is around the creation of buffers in general. First, there's the once again this idea of changing priorities and dropping tasks. That is a typical way of freeing up resources so that they can be used for other things. One also type of buffer is to make sure, and that's also something that is done in domains like firefighting, like military operations and things like that. They don't often operate without buffers, so they deploy more resources that will be necessary, and they have resources on site that are able to operate if needed. Because once again, if those resources are requested when they are needed, by the time they arrive on site, it might be already too late, or the situation might have degraded significantly already. So they have this as part of the tactics. For example, having tactical reserves is an important aspect, which means you deploy those resources in advance.
Can I say there, Matthew? There's a slight aspect to that where, especially in EMS personnel that are part of the buffer but are never used, there's an enormous frustration for not being allowed to take part. It can sound very, very strange, but when you're a trained personnel, you actually want to respond when there's a major event. And I know in the case of the attacks in Belgium at the airport, there was an enormous frustration from EMS personnel that were called in as part of the tactics, but weren't actually used in the incident. They had to have sessions with this personnel afterwards to talk through the whole situation when they were wanting to respond but weren't allowed to take part.
Right.
Just a sidetrack to that.
Right. Yeah. Well, it's a trade-off. Yeah. One of the things that when I worked with the firefighters, one of the things that is related to having resources on site that are ready to operate is basically that they are very careful about avoiding situations in which everybody is busy, because in that environment in which the fire might behave sometimes in surprising ways because of for example special material that is in the area or things like that. If everybody's busy and something else happens, then everybody's already busy. So you don't have additional capacity.
Yeah, no, and I'm not disagreeing to what you say. I agree with you. There should be the buffer.
Yeah.
There should be a tactic for it. It could be something that goes into the after a crisis, or the importance of organizations picking up on the personnel that were part of the plan but weren't actually used, because there's a feeling of being left out.
Yeah, that's interesting. Yeah, I think in the firefighting world, it might, in a sense, when you have a situation where whoever is operating, that depends on the location of the fire. So, sort of statistically, you will have people that might be the tactical reserves one day, and in another situation will be the ones operating. So maybe it's sort of creates a situation in which everybody's involved over the long run, which might be different from the EMS situation where I don't know, Johan, maybe you know that.
Well, I can speak from a Swedish perspective then. Well, if you're on call and if you're on duty, then you're working. But in our county council, then the emergency plan, the backup plan, is actually calling in available personnel. And just the fact that Sweden aren't used to mass casualty incidents happening every day, so we will have a problem of everyone wanting to attend rather than having a tactical sound approach to enough people, but then also building on resilience, building on being able to respond 8 hours later or 24 hours later. That will be a bigger problem here rather than not getting anyone responding. But apart from that, no, I would think that Norway and Sweden and fire considerations are exactly the same. There's a more buffered approach to it because you have smaller fire stations that will have a 5 to 10 minute call time from when they receive the alert to they actually have to be at the fire station.
Yeah, I was just reminded by a work I did with the ambulance emergency a couple of years ago when I looked at the change when they, how should I say, when Sweden moved to a more specialized ambulances nurses rather than the more generic that was before. I remember the ambulance drivers that was not nurses at the time. They have been somehow degraded to just being drivers since they were not allowed to work in the ambulance as nurses anymore.
Right.
So I think that would be an example of when specialization is removing buffers, because they had a problem at the time that there was only one person was able to drive the ambulance because the other person was needed in the to do the medical supervisions, and so the organization had problems there because the roles were so fixed suddenly.
So what you're describing is sort of this tension between people having very specialized roles versus a bit more general competencies, which would be part of I think an important point, part of this sort of management of competencies within an organization.
Yeah, exactly. Because there was a law introduced that only nurses was allowed to administrate drugs and medicines, right. And that effectively made it impossible for the ones that was only, in citation marks, ambulance drivers to do the work that had been previously done. So, if I remember correctly, this was quite a few years ago.
The same discussions are still ongoing, though. So, so you're right.
I mean, and the specialist generalist debate is as a fundamental trade-off is one that doesn't have any answer. I mean, clear answer. So, but it means for us in terms of guidelines, the organization should definitely think about it and then look at how they are managing their competencies in light of that trade-off, right? And recognize that maybe they are either moving in a direction that they shouldn't be moving in, or that they could put in place some mechanisms to improve the situation.
Yeah, exactly. And I think also the organizations need to be aware of that there are some skill set that was previously quite available in society, in the public, that maybe not be the case. For example, less people are having driver license or are educated as licensed truck drivers than before. I think that was a problem in the emergency service. In the people that started working a long time ago, they had a license for truck license. But the new nurses did, so they were not allowed to drive the ambulance because of that. So that increased the need for driver education. I think it's the same problem in the military and police, that the new recruits to the police, they don't have driver licenses at all, and that's a new situation. So we need to put more effort in such training. So a resource that was available earlier isn't anymore.
Okay. Any additional comment on this around this idea of creating buffers and buffers in general? If not, the last sort of general point that I made here in this guideline is really this need during the crisis to have clear understanding and clear a clear understanding of this issue of who controls the resources, but and also on based on what information. There are lots of examples, for example, in the literature of that highlight how in some say a flood type situation, you would have it's very important to be able to rely and give some discretion to the people that are operating locally, because they have a much finer understanding of the local context. For example, might have a better understanding of where the more vulnerable people are, or might have an understanding of who might have some special equipment, like farming equipment. We had this example earlier in the conversation, and so giving some discretion to those local resources to use that knowledge and to make decisions about the use of resources is a way to be more effective in a situation. But of course, the difficulty here is that at the same time, there's a tension here where you cannot only rely on the local decision for the use of resources, because there's a need to ensure that the resources are used, when you look at a larger scale, are used in a correct way, in a way that doesn't risk, for example, that one local area is doing fine while another is depleted of resources, for example. So the capacity to monitor the use of resources, that actually, Frederick, that might be also an area in which technology can help via communication and via potentially some automated means.
Yes, but when you start resources, you start using money, and the command line can authorize usage of resources to be paid. Must also be in place, so that can't be handled technologically. Yeah, but when you start actually using them, coordinating them, activating them, that can be aided technology wise, and then also if you have and if you use technology to support decision making, that that your higher authority can actually allow a usage of those resources, then you can get the flexibility that you needed. But if you have only the technology to coordinate resources, but you have not tied into those who can actually authorize releasing the funds that pay for the resources, you will have that block.
Yeah.
Just want to say that I know that there are in Israel some startups dealing with the balance between needs and resources, and by technological means, how to manage it. It's very important. It's very hot issue. that I think that the technology will be very important actors in this area. Because it will based on one system that can recognize the needs and the available resources that we can move from one place to another.
But one observation, a thought about when you also prepare for the crisis, that you can, if in the moment you have created a list of resources, it's outdated. So if you rely on a centralized way of handling lists and lists of resources, you will never have an updated list. So in order to sort of make this work, you need to delegate the sort of make it possible to self-regulate on an individual basis the resources and be tied into a distributed network of actors that sort of have an incentive, and also just day-to-day through day-to-day usage ability to sort of show their availability. But if you rely on lists, which actually I think most do, then you will very soon discover that when you need resources, it's not available, and you need to spend a lot of time to activate it or get shit done. So in order to solve that technologically, you need to distribute the ability to add without making it a big hassle to do so. So it's not easy, but if you manage it, then you have something that can self and repair itself, so to speak.
I was wondering, I don't know if you know how that works. I don't in detail at all, but the way, for example, the snowing conditions are managed, and when there are surges in amount of snow, or so in demands relative to the amount of snow, that could be an interesting sort of small scale way to look at it, because if I understand correctly, it relies a lot on individuals that have some snowplow kind of capacity, that are, I guess, registered people that the local towns or villages can rely on. So I guess they use some kind of roster that has to be rather up to date and updated on a regular basis. Do you know that, Frederick?
That's outside my scope of knowledge in detail, but I can observe, because I grew up in the country but now live in the city, is that in the country you have the local farmers. They have the snowplows and the equipment to clear the roads in their own area, and they have rates for compensation set probably by the municipality. My impression is that in the municipality you have a more professionalized system, but if the municipality do not set aside enough resources so that they can activate the amount of money that they set aside is spent, and then they stop snow mowing, and then you get a crisis, and then you need for the correct authorities to do a crisis decision to open up the monitoring again, and then they start mowing the snow again. So again, it's not if you have I think if you have distributed trust and you trust that people do not abuse the system, and you have set aside the funding so that those who actually do the work know that they get the money for do the necessary work, then you are able to have a distributed system that just works. But if you scale that up, you need more professional trust. You can either rely on lists, which works fine, or you can. But if you want to expand it beyond normal, snow is normal situation in Norway. That's why this works. But if you want to expand access to resources that are not as predictable as snow mowing, to increase the resilience and the flexibility, then you have to be more distributed and individual. And I'm not sure that many do that, except for us.
In Israel, the local authority is the main thing, and they have activation center in time and during a crisis. The thing happened there, but it's appropriate to the scope of the event. Yes, as much as it's longer, it will be longer, and the scope of this event, the army or the authority, the national authority, send delegates, yes, or some representative to the center of the local authority, and then they manage together the local resources and needs and the national, with the national support. So this is how it goes in Israel. So the local authority, this is the main representative thing that they move.
So you're saying that it's a local authority, but with the basically sort of a national representative being detached to sort of look at the problem together, right?
Yes, and if they need help, they can ask to bring them more things, and they have connection to the national center, yeah. Or level. They can be supported by the army, a lot of times by the army or by the police or something like that, but they have connection a lot of the time with the army.
What I observed being with the fire brigades is that they may have overview of the resources that can be have the list of resources that can be activated, but they want the police to be the one who orders it, because they are tied to the Department of Justice, which have much deeper pockets than the local municipality. So how it works there is that the local, they just ask the police to order the resource because they have the budgets to actually do it.
Right.
And all of them sit together in one place so they can see, and they have networks to be in touch with other organizations or agencies, so they can be in touch and they can manage the situation.
In Norway, they don't sit together. There are we have just 5 million people, but there are 48 emergency services divided into 3 different services: fire, police, and medical. So they don't sit together, and except for a few exceptions. But they coordinate each other through voice communication, because they are in silo systems that don't talk to each other.
All right.
All right. We talked about lots of things. This particular card will be shared soon. There are some illustrations. There are some relevant some practices that are. I mean, some of them we've discussed. That will be described in greater details. Some of them come from healthcare. I read this interesting thing. I have to go back to a bit more detailed, but this, in order to share staff and resources across organizations, they have in some places they have created those sort of healthcare coalitions, which sounds quite interesting. So things of that kind. So once this document will be a bit less drafty, it will be shared across the DCoP members and all, and it will be more public. And it will be possible to provide feedback. In the meantime, we're closer to the end of the webinar. So if you have any comments, any last thought that you would like to share, would be great. Any questions, things that we could have covered better? And I'm sorry, so some of you, I'm happy to see that some of you have joined. Unfortunately, yes, it's towards the end, but I hope you got some information nonetheless.
Thank you, Matthew.
Yes, thank you, Matthew. Thank you. That was very, very good and interesting. And for those of you who did come in slightly late, this session has been recorded and will be published on the DARWIN homepage at a later date. So we'll inform you all when that's been published, so you can listen to it from the beginning. But thank you very much, Matthew, and especially thank you, Fredrik, who's part of it from the start and sharing your knowledge and thoughts on the matter.
Thank you, everyone. The recording will be on the homepage at some point?
Yes, that's right. I'll send an email out to you all when that's been published. You'll find out then. And the next webinar in this series is on the 27th of June, and it will be Odeya who's been taking part today, and the topic will be on the... Or do you want to present the topic, Odeya, shortly?
Yep. It's about the involvement of the public in resilience management from the perspective of the organizations.
Yes. So we're looking forward to some more very good discussions, and if there are no further questions, I will all say thank you very much, and thank you again, Matthew.
Any question? Then I'm fine with wrapping up. Thank you very much, everybody.
Thank you.
I'll talk to you later.